Okay, welcome everybody to COVID Science Solutions and Success Stories. Continued. We've been running quite a few of these since the start of the pandemic. And really this session, we're learning from our peers and we're looking at COVID-19 prevention approaches and protections for essential workers around the world. We're a bunch of occupational and environmental scientists or occupational hygienists. And, we've got occupational hygienists from Canada, from the US and from Australia. And, the order of speakers is in front of you. So we've got Marc-Andre, who's going to be talking about recognize the occupational health role in prevention. And then we've got Jonathan Rosen providing a US OSHA update around the emergency temporary standard, and also going to be talking about the importance of training as well. We've got a recording from Kate Cole. So Kate Cole's the president-elect of the Australian Institute of Occupational Hygienists. And then Lawrence Virchev from BC, he's also going to be talking about lessons from the past as well, and talking about zero COVID workplace infections and the necessary, noble and achievable truth. And these are the great panel of speakers here, and very fortunate to have Marc-Andre Lavoie, who's just finished as president of the Canadian Registration Board of Occupational Hygienists, and he's also a current board member. He runs his own consultancy, Riskmarker, and he's got many years of experience in occupational hygienists. So he's a lead in Canada, and he's presented at many conferences, and I believe he was also an adjunct professor at McGill at one time. He's also been a corporate advisor for Rio. He's our first speaker. The second speaker is Jonathan Rosen, who's a principal consultant for AG Rosen and Associates. He's had a lot of experience with unions, and he's also worked for the National Clearing Waterhouse, Workers' Health and Safety Training, served as Director of the Health and Safety Department for New York State Public Employees Federation for 22 years. He's got a master's degree in industrial health at the University of Michigan, and he's also a certified industrial hygienist. So I forgot to say, Marc-Andre Lavoie is he's a registered occupational hygienist. That's the Canadian certification. So the third speaker is Kate Cole. So Kate Cole's the president-elect of the Australian Institute of Occupational Hygienists. The Australian Financial Review actually put her in the top 100 women of influence. She's also a Winston Churchill Memorial Trust fellow holder. She's a certified occupational hygienist, COH, that's the Australian designation, and she's also the acting deputy executive director for health and safety at Sydney Metro. She's got a master's of science in occupational hygiene practice from the University of Wollongong, and a Master of Environmental Engineer, University of Sydney. And the great thing about Kate is that she's played a national role in Australia in the Infection Prevention and Control Panel, which I'll talk a bit more about. Next, we've got Lawrence Virchev. It's been my great pleasure to get to know Lawrence from when he first presented through Workplace Health Without Borders, and we belong to a sort of a coalition, and we do a lot of networking together. And it kind of came to me that, we've actually been through this before with SARS, and there's actually a document called Protecting the Faces of Healthcare Workers, and Lawrence is actually one of the co-authors on that document. And we've also got a guest joining us through Lawrence, Vivian Damping Sheng, who studied medicine in China, and she's got a diploma of occupational health and safety from BC. And Vivian's also going to be co-talking alongside of Lawrence. Before I move on, I just want to say that I'm the former president of Workplace Health Without Borders, and we kind of look at issues in developing countries. And one of the board members that joins this webinar quite regularly, Claudina Noguera, her family's been badly hit by COVID. So she's based in South Africa. And I don't know if she's listening in on this, but just our thoughts go out to you, Claudina. And thank you so much for everything you do. Okay, so when we get to the third speaker, which I'll be introducing Kate, these are the questions that have been put to Kate. And as I said, Kate's kind of a leader in Australia. She was interviewed on the ABC report, and I played her recording previously, but she's also shared a recording about what has been done more recently, which is quite exciting in Australia. And they've developed this this national standard, which she'll also be talking about. A part of the coalition that I belong to, Alec Farquhar, who many of you will know, is kind of the lead and the catalyst for this coalition. On the coalition is Dr. Jen McDonald. So you'll see in the last week, actually, there's been a lot of media play around the importance of aerosol transmission. And Jen's been a leader in the field for Canada as well. And then in the Globe and Mail, there was a centre spread, how to keep workers safe from COVID-19, focus on the air they breathe, and the growing evidence for airborne transmission of COVID-19 is now widely known by the medical community. Why has that message not, for the most part, trickled down to some provinces, public health units, employers, workplace safety guidelines? The investigative journalist is Tavia Grant, so she's spoken to quite a few of us, and it's a great article, so I recommend you read that. And then the other night, June the 17th, we also listened to this, and it also featured Mario Osamai, who has also presented through OCAD before, and it's really well worth watching as well. It's just reflecting back and the lessons learned, and just it's good to hear Mario provide his perspective as well. He was the lead investigator for the SARS-1 Commission. Okay, so what I will now do is I'll stop sharing and I'll hand you over to Marc-Andre Lavoie. Thank you.
Thank you, Kevin. A nice introduction. Since we're in COVID time, I have to say that what I'm going to present has not been peer-reviewed by anybody, and this is common in COVID time. So Lancet, we have more and more articles, scientific articles that have been published that were not peer-reviewed, and that means that it has an impact on the communication when these articles comes out, and it creates some uncertainties that needs to be dealt with. Today, I'm going to talk to you about mostly my role as the ex-president of the Canadian Registered Board of Occupational Hygienists. I will review a few little things about what industrial hygienists are, some point of view that we have about the future of the profession, and try to link it to COVID at the same time, but I will not do anything technical because I have eminent colleagues that will discuss about more day-to-day importance of messages that we're trying to pass by. Let's go. First thing is a little mindset for the discussion. One thing to learn about public health issues is that it's never a purely scientific problem. It is a scientific problem that is combined with perception of the risk of a various stakeholder. And so I need to declare that I do have a bias, and my bias is towards that the profession of occupational hygiene is extremely important when public health issues arise. I also have a bias as a citizen and declare that I am politically centralist with left-wing influence. I come from the time of the union strength in Quebec in the 1970s and all the battles with exposure to asbestos and all of those things. So I kind of have a bias towards that when I look at a problem, which is a lot to do with the perspective and a lot to do with the the perception of risk that people may or may have. Now, to why I talk about bias is because bias is the biggest obstruction when dealing with uncertainties. And the scientists are we're not like black and white people most of the time. We are people that are trying to reduce uncertainties, but there's always uncertainties that remain. And sometimes political view, human resources view, industrial views will use these uncertainties to twist the message. And it's important to consider it and to know the people you're dealing with, where they come from. So in order to reduce those bias, it's important sometimes to make some clarification, definition of concepts so we can work from common ground. Today, I'm going to talk about the importance of the occupational health profession, and I already stated my bias towards that. The CRBOH has started last year, and it's going to be a fairly long-term initiative, but we started a Future of the Profession initiative, and I will explain why we feel that this is very important. And finally, I'll discuss a little bit about a path for a Canadian approach toward pandemic prevention. All right. Now, I told you that I have a bias towards industrial hygiene, and it started very early in my career. The first time I went to the American Industrial Hygiene Association conference and exhibition in Washington, that was 1996. I went to see the presentation, an award winner, and the award winner nominee was the next CDC director. And the theme of his presentation was my love affair with the occupational hygiene profession. And what he said touched me, and I still have this deeply ingrained in me, is that every aspect of public health and safety would be greatly enhanced by the science and practices of occupational hygiene. And this is for me very important. This gentleman was a physician. So when he was named as a CDC director, he had no idea what an occupational hygienist was doing. He learned it there. And I find that the more people get to know us, the more they come to us, and the more helpful we are. One thing that we had a discussion yesterday that I wanted to clarify, because if people don't understand what is occupational hygienist is, occupational hygiene is an intrinsic part of public health. Basically, public health was responsible for the health and safety of citizens. And from there, through Miss Hamilton in the US in the 1920s, a section has been developed that was more focused to the workplace. But really, public health, occupational health is a daughter of public health. And when the COVID crisis started, I believe in this so much that I thought that in the province of Nova Scotia, there's 10 certified registered occupational hygienists. I would get a call from public health and say, we have a public health issue, we need help. Well, that did not happen that way totally. So there's something that is missing between my perspective, my perception of what occupational hygiene could do to the public safety, and what are the public safety leader perception of what I can do for them. And I think this pandemic might be an opportunity to bring it to the forefront, the science of occupational hygiene. Now, from an occupational hygienist perspective, an hospital or even other healthcare settings, they're no different than any workplace. And one of the issue about the recognition of aerosol transmission. So when I go into a workplace and I say, you have a problem with emission from your process, there'll be an engineer in there that is responsible for this process. And he will say that he's responsible for the safety of his people. Who am I to tell him what to do into his engineering work, right? And then I need to convince him and work with him, and then I get somewhere. In an hospital, with the virologists that say they're responsible for the occupational health of what mask they're wearing, when they're wearing it, why they're wearing it, and they don't want to hear about a professional in the field to help them. Well, it's exactly the same problem. And one of the key problem is when I go into a regular workplace and I tell a worker or workplace, you guys will have to wear respirator until we solve the problem. I need to convince them I'm an outsider. But it's exactly the same thing that is happening. And those people have a bias because they don't want the extra burden of the respirator. One of my perception of the issue with the acceptance of aerosol transmission and requirement for higher respiratory protection is a bias towards we will have to wear that extra equipment and we don't need to wear it, and they're sitting in their position, and that makes the problem a little bit harder. Now, I said earlier that I would talk about Greek mythology. So we can say that I'm an occupational hygienist, and I can say that I'm a chemist or whatever my background is from. But basically, in terms of risk communication, I always refer myself and other occupational hygienists as Cassandra in the Greek mythology. The question that an hygienist always had, and that took me a long time to understand, is I have data, I have information, I know that there's a problem, but nobody listens to me. So that's a bit what happened to Cassandra. So Cassandra in the Greek mythology, she's the daughter of the king of Troy. Troy being a city that was renowned for being invincible. She was very beautiful, so Zeus approached her, and to try to charm her, he told her, I will make you a gift, and your gift is to be able to see the future. But that was not good enough, so she ended up with that gift, but she kept refusing herself to Zeus. She was not interested. So he got very frustrated, and he came back and he said, I'll give you a second gift. You will keep seeing the future, but nobody will believe you. Now, what happened is that Cassandra managed to predicted the fall of Troy, and nobody believed her. And when it happened, something extra happened. What happened is that not only did they not believe her, but when it did happen, they blame her for it, saying she was like a black bird seeing the future, and it was because of her. I heard about epidemiologists that went into village and they describe prevalence of cancer situation created by the industry and the surrounding, and people told the epidemiology, you leave because there was no cancer before you got here, right? So we're in this situation with the recognition of aerosol transmission. As long as we don't say anything, everybody's fine with it. But it helps understand a little bit of the dynamic behind those things. There's something I'll go quickly on this one because, but just to show you that it's important. There's been an article produced by a French scientist, Bob Jessu, and it's more like I don't know how to describe it, but he talks about what happened. Why did the medical community refuse to recognize the aerosol transmission? And he talks about medical scientific orthodoxy. What my understanding is of this is that they know their science, they know their stuff, and they don't need anybody to help them. And not only did they do that while we were pushing them, but they pushed back on us. And they said that when we started to say that there was aerosol scientists that they were excluded from the decision making, they described us as that our ideas and methodology were weak, our empirical finding was untrustworthy or insignificant, and our contribution to the debate was unhelpful. Now, this is kind of drawbacks to what I said at the beginning is we have to work together, and they barely refuse to work with us, thinking that they knew better. Like we'll know in the future what happened, but this is happening consistently. And back to that doctor that was saying my love affair, he went beyond that bias and discovered something quite interesting. So I hope that things change in the future. And that's why we're kind of here to discuss it a little bit. All right, just as my role as president of the CRBOH, this is what we presented at our AGM. I have a few extracts from it that I want to discuss about. But there's something that is happening in the field of occupational health and safety. And we feel when we did the diagnostic at the beginning of the year, what do we need to do? We realized that there's pressure to redefine the roles and responsibilities of various players in the field of occupational health and safety, and potentially achieve professional recognition via title protection for occupational hygienists. That might be hard to do, but there's something I will discuss a little bit about that. And from that diagnostic, we set up a subcommittee that is called the Future of the Profession, and I want to talk to you a little bit about this. Pass that. Now, just for those that are less familiar with occupational hygiene, and sorry about the slide being in French, but you can find this in books. So this is occupational health in French, hygiène du travail. So occupational hygiene, what is difficult about getting a professional recognition is because it's not a straightforward profession. It's something that is developed beyond your formal education, and many science could fit into the field. So if lawyers are a recognized profession because you go to law school, you put your exam, like the path is straight. To get into occupational hygiene, there's many paths that gets you there. And that makes it very difficult in terms of definition of what is an occupational hygienist. But we do through the CRBOH and in the US ABIH, and there's the same type of system in Australia and in the UK on how you recognize occupational hygienists. All right, so the science that we find in this field, engineering, medicine, ergonomic, epidemiology, science, biology, chemistry, mathematics, physics, toxicology, statistics, and occupational safety. Now, occupational health, I believe, is naturally placed to coordinate problem-solving effort requiring multidisciplinary inputs. So it's a multidisciplinary science. So for me, in my example, and I'm sure my other colleagues have their own story, I'm a chemist by trade. I have a master in electrochemistry, which is not that relevant if you don't know. It is relevant in terms of gas detector. So I'm starting here, and then I learn all of these things, and I passed an exam that gives me basis in all of these other fields. And that's what makes me an industrial hygienist. So it is important to recognize the multidisciplinary. Now, if you're a pure chemist, there's things in occupational hygiene that you can do, but you cannot do the whole thing, right? So that's the thing. We are a multidisciplinary approach. So epidemiologists will give us perspective, but hygiene, occupational hygiene, will put it in a broader perspective, and it's a nice thing. So the question is, I found this, sorry, it's in French again, and I can use my own pen here. This comes from a Belgium professor in Belgium, and he defines the issue is that do we need an expert in all situations related to occupational health? And when does a generalist could solve the issue? And when do you need to climb up the ladder to go get some extra science? So basically, any worker, any supervisor, any plant manager, they're kind of here at the bottom, which means they treat all situations related to their workplace. So they'll deal with the ergonomics, the noise, the et cetera, all the things. And then you may have some issues that are a bit more complicated that needs a little bit more knowledge. So then you have that level of generalist health and safety professional. And then there's a few situations where you need more of an expertise. And I'm not sure if the hygienist fits here or here. It's still to be defined. Jacques Malchak, thank you very much, Dorothy. Yeah. So here, when you get to this level, that's where you get your ROH, CIH kind of expertise that comes in. And I'm not sure where to put it, because sometimes you need to go back to the basic science. Sometimes you need to go back to the PhD in chemistry. In the case of COVID, the epidemiologists have been extremely helpful, and there's some biologists, bioscience people, engineering when we got into transmission. So us experts, we're riding in this part, but we are of no use if we cannot communicate for people that are doing in this part, which is my friend here that has a little computer shop. He had to put his COVID prevention program. So you have to go from these things down to these things, etc. So I want to show you something about the specific occupational hygiene in Canada, and I'll probably stop there. So the Americans have an history of occupational hygiene that is older than the Canadian ones. So historically, all Canadians that wanted to practice industrial hygiene were going through the American exam process, which gets them to be CIH. At some point around 1986, some people said, you know what, like a doctor is recognized in the country where he operates because he needs to know the specific about that country. It's the same thing about occupational hygiene. And that's why you have occupational hygienists in Australia who have their own exam process, same thing in UK, etc. So in Canada in 1986, we did the same thing. And what we did is we took all the CIH from the past and we gave them an equivalence to be ROH. So we ended up with a population that were CIH, ROH, both of them. So right now, our total number of registered occupational hygienists in Canada is 249, and it is declining. We have CIH that are practicing in Canada at a number of 344, and they are rising. And we have still 125 people that hold both certification, right? So most of them are probably coming from the initial recognition from the get-go. So from a Canadian perspective, our number of occupational hygienists is declining. As a total number, we're pretty stable. So why would it be important to have all practicing occupational hygienists in Canada being ROH? It's because when we need to deal with Canadian issues, we need to be able to join our group. When we need to influence our government, we have to have our whole strength. So right now, when COVID, we tried to reach all of our hygienists, I was missing 3/4 of the hygienists in Canada in the database that I was using. And I think that's problematic. And this is something that we need to solve. These numbers are actually fresh from this morning. If we look at the number of industrial hygienists in the US, we are close to 7,000 active ROH. So it's a big number. But when I was talking with the BCG CEO this morning, he said, who cares about the number? We should be 100,000 practitioners worldwide. And why does he say this? It's because when we talk about health and safety, in the UK in 2013, I believe, and it's constant, there has been 133 deaths that is due to accident at work. And there has been about 13,000 died from related disease. So why is it that we have a ratio of 10 to 1 in terms of safety professional compared to health professional? In various countries, it's standard everywhere, when the problem is reversed, where we should have more of these and less of these, but not less of these, but we should have more of this one. So I have all kinds of things about that, about why is the profession important, and I strongly believe that the move forward in terms of supporting a future epidemic prevention playbook will be greatly help if there is more occupational hygienists that could give their perspective when we finalize this, and not keep this into a confined specialist mode, but really create teams that involves all the future. And this is what we've been doing in Canada with the aerosol transmission coalition. You have people from all field together, and that's why I believe we reach success. All right. Thank you very much.
Thanks, Marc-Andre. Really appreciate it. So